I'm Dr. Angelica Delgado Rendon, and I'm an instructor of public health. Today, I'm going to present to you the epidemic of loneliness and the connection between social connectedness and health. Um, to begin with, um, there's been some research done about the factors that are associated with having a long and healthy life expectancy. There was a journalist named Dan Buettner. Pardon me for my accent. So I don't know if I'm pronouncing his name right. But what he did is, as a journalist for National Geographic, he went around the world finding places where people tended to live very long life. And he found actually about 6 places around the world where people were more likely to live up to 100 years or longer. They were in different places around the world, like in Costa Rica, Japan, United States, Greece, and Italy. And he referred to these zones as the blue zones. And he made some discoveries. But he was a journalist, of course. He's not a scientist. So, following up with his journalism work, some scientists have traveled to these places to try to understand why people in these locations are more likely to live long lives. Not only do these people live longer, to be, longer than 80, 90 years old, 100 years old, but they're actually healthier than their peers in other places. They're less likely to develop Alzheimer's. They're less likely to have conditions like diabetes. And so that allows them to um, enjoy their long lives, not be burdened by these chronic conditions. So what researchers have found is associated with these long and healthy life expectancies of people living in blue zones are the following: healthy diets. This is associated with, eating fruits and vegetables, legumes, a low to moderate, a little bit of wine consumption, low consumption of meat, a constant moderate activity. This is a physical activity that happens naturally, on a regular basis, more like, when we plan to go to the gym 3 times a week, but rather they move constantly. um, they walk to places, they do gardening, for example. These people also appear to have a strong sense of spirituality. They're more likely to be a part of a religious or spiritual community. People who attend religious services 4 times a month have been found to live on average 4 to 14 years longer than people who are not part of a religious congregation. And this is not specific to a particular religion, but several major religions have been associated with this outcome. Could be Buddhist, Muslim, Christian, Catholic, and so it's just, you know an association. Um, People also tend to have a sense of purpose and positive outlook, sort of a reason why they wake up in the morning. It's not like just work, because when we retire, people retire usually, between 60, 70 years old, and then a lot of people lose their sense of purpose with their job. So these people have an overall sense of purpose for their life beyond just a work. Um, they tend to have low stress lifestyles. They're socially engaged with the community, like neighbors and other community members. They also tend to be intergenerationally connected. So they are in contact and regular contact with parents, grandparents, children, grandchildren, also, just extended family network like siblings and nieces, nephews, and so on. So what is the definition of social connectedness? There's different definitions. So one is social connectedness refers to an individual's engagement in an interactive web of key relationships within communities that have particular physical or social structures that are affected by broad economic and political forces. Social connections provide people with the emotional support, material help, and information we need to thrive. Social connectedness is the sum of individual relationship, but also a sense of belonging. Okay, so both are crucial to overall health and well-being. And when you think about human beings, our human evolution, it really makes sense. I mean, for the last 10,000 years, if not more, we have been mostly an agricultural civilization. And to be an agricultural civilization, to grow food, we really need collaboration among people. I mean, this also happens in before, right? In hunter-gathering societies, then in agricultural societies. For all of this, we need this sense of social connectedness where we help each other with the labor, with the labor in the field, but also, the raising of the children and so forth. And then we share the food, right? We do some trading to exchange of the goods that we have for the community. So not being a part of the community, that means being excluded from a community, has actually, if you can imagine, if you need other people to grow food, to cook, to reproduce, you can imagine how being excluded from a community can have very bad repercussions that we will talk about here. So I'd like you to pause the video for a second after, of course, and I'd like you to complete this survey for yourself. This is a very brief tool that measures social connectedness for adults. So for each of these statements, I'd like you to rate whether you strongly disagree, you're undecided, you agree, or strongly agree with the following statements. So number one, I am happy with the friendships that I have. Number two, I have people with whom I can do enjoyable things. And this means that you can really count on them to do things in person, okay? Preferably in person. So say you really want to go to a concert, you have somebody that will be there for you to do these things with. That is not like hard, like, okay, maybe in 3 months when my calendar opens, but you really have people to do these things. Number three, I feel like I belong in my community. So maybe there's a fit, and the people around you makes you feel like you actually belong with them. It could be any community, could be school, work, religious community, neighborhood association, the gym, any community. Number four, in a crisis, I would have the support I need from family or friends. And this includes actual support. So being there in person, God forbid, I have to go to the hospital. I have somebody that would come pick me up, that would be there. I have somebody that may loan me money if I have an emergency. So it's actual support and not just, posting like people who like your post on social media, right? So after you have completed this, you can do the rating, add all the points, and then divide by 4, and you get an average for sort of an estimation of your social connectedness. And what we have found is that a person who is considered to have an acceptable level of social connectedness has an average value of over 3.5. Okay, so if it's lower than that, maybe not acceptable, and the person needs to work on this. And this tool is usually used for people who are, maybe attending depression programs, maybe addiction programs. So at this point, the counselor knows that there is a sign that they could work with this person on increasing their social connectedness to better their well-being. People who say that they are being socially connected are more likely to have regular, meaningful in-person interaction. Notice this, that it is in-person interaction and not just online. Online interactions, I think they're good, but the research has shown that they're not as valuable. They don't have um, the same outcomes, the same value as in-person interactions. Um, they are perceived to be in good overall physical and mental health. They tend to be employed and have good relationships with their coworkers. People have found a balance in their daily activities, so including they have the right amount of sleep, socialization, and work-life balance. They tend to be married and live closer to extended family members. This means that they tend to be more securely attached. Okay, so this is a secure, a healthy, securely attached. We're not talking like a codependency, but more like a healthy, secure attachment. Um, so instead of, I think it's a little bit maybe more complicated for people who have like an anxious attachment or avoidant attachment, but we can still work on this to have a secure attachment. But the point is that we people who report being socially connected have this web of people, especially starting with a romantic partner, to other um, family members with whom they have long-term secure attachment that they can count on. Okay, it's more than just having like casual relationships or just seeing family during the holidays. um, so that is not what we mean. So now a little bit of introduction to epidemiology. If you have not taken epidemiology yet, or know these terms from our recent um, pandemic of COVID that we had, I always say to my students, if at this point somebody doesn't know what the term pandemic means, they've been living under a rock, right? Um, so a little bit of introduction though. Endemic means that when we say that a disease is endemic, what we mean is that it's usual occurrence in a geographic area. So maybe like the flu, we kind of expect the flu during the flu season to have a certain number of people that have the flu, and then a few of those people may end up in the hospital um, for a further care for this. What we mean by epidemic is when this number of cases are actually out of the ordinary, when they, for some reason, they are, much higher. That points to epidemiologists, to doctors and public health workers that, hey, there is something wrong here. It's not usual. Uh, this is what we call an epidemic. And more often than not, in the beginning, we may not know what is causing the epidemic. It may be one cause. Sometimes it's a combination of factors that are causing this epidemic. And so the work begins for health professionals to figure out what is happening. We don't have the resources because it's epidemic, is outside of the normal, right? To deal with this health crisis. Um, so then we study the factors that are associated with the epidemic to try to first prevent. I think the first line is prevention. um, well, okay, some people may believe it's management, right? First, management of the cases, followed by what can we do to prevent this situation. But for me, prevention is key to stopping an epidemic. Kind of like, for example, for COVID-19, kind of like it is wearing a mask, doing some physical distancing, right? Because this brings this curve. This is what we're talking about when we say bring the curve down. This brings the curve, the number of cases down to a more manageable level. But so this is what it means by epidemic. So we have currently in the United States, we have an epidemic of loneliness. How do we know that we have an epidemic of loneliness? Well, there's been some research studies, and we've measured um, this this phenomenon. There are different definitions that are used to study this phenomenon, and so there's something called social isolation, living alone, and loneliness, and they're not exactly the same. So for one, is social isolation means being can be physically or mentally isolated from other people around, right? So people, when we say somebody may have depression and they withdraw from social activities, right? So that can be social isolation. Living alone, well, just means living alone, right? Versus just living with another person. Even if it's somebody like a roommate or somebody else that we may or may not be like romantically involved, it could be a child, a family member, right? So, and then we have loneliness. So loneliness is not just being physically isolated or living alone or being excluded, but it's actually the feelings or of being isolated, the feelings of disconnection, of not belonging. So this could be, I don't know if you've ever read about somebody who feels like they're in a room with a lot of people and they just don't feel like they belong. Maybe they don't strike up a conversation with somebody, they don't share interests with them, or maybe other people make them feel like they're not welcome, that they're excluded. Um, I've seen also the case where, for example, some Hispanic families where I've met some grandparents who they have told me they live in a household with their children and grandchildren with like 8 other people in the household. So you would think that these people are happy, right, with their family and healthy. And when I talk to some of them that are depressed, they tell me, I feel lonely. And I say, how do you feel lonely? You live in a house full of people. And they may say, well, my children are working all the time, so I never see them. And my grandchildren don't speak Spanish, they only speak English. So I can't communicate with them. And my grandchildren, they don't like to do the same things that I like to do. They prefer to be, playing video games or something, and they don't actually engage with me. So this is what loneliness means. It's more complicated. It's not just being with people, but all of these three factors are being studied because all of these have been associated with an unhealthy outcomes. These are all the different examples of different measures that you can look up for studying this, as well as the previous measure I showed about how to measure social connectedness. So let me show you this video. I hope I can click on it.
Do you ever feel lonely? Well, you're not alone. A new study from Cigna says most Americans feel lonely, and the group most at risk isn't the older generation, it is one of the youngest. Researchers found loneliness is a major threat to Americans' mental, physical, and emotional well-being, and it can have huge consequences. Dr. Doug Nemesic is Chief Medical Officer for Cigna Behavioral Health, the global health service company that conducted the study, and he joins me now from Minneapolis. Doctor, thanks so much for being with us. Can you first explain what loneliness is exactly for the purposes of the study?
Sure. Thank you for having me on with you today. Loneliness is defined as a feeling of being alone or lacking social connectedness. And at Cigna, as a global health service company, we've been hearing more and more from our customers and individuals calling us that they're feeling lonely, alone, and disconnected from others.
So, certain demographics in the study were worse off than others. Generation Z, which is adults between the ages of 18 and 22, were the loneliest generation. Why would that be? That seems to be sort of the prime of your life.
We looked across all generations, and you're right. As you said, we were very intrigued to find that the youngest generation of 18 to 20-year-olds actually felt the most lonely. And in addition, they also felt that their health was worse than older generations. we can't really point to any causation from this, but it's interesting, and we do want to follow up on this and continue to work on ways that we can impact loneliness in that generation.
And so, Dr. Nemesek, what do you find most alarming about this study?
One of the very interesting things that we found was the connection between loneliness and health. So, from a health standpoint, other research has shown as well that loneliness impacts heart disease, diabetes, depression, substance use, and overall feelings of health. But what was nice about our study is we identified that those people who have meaningful in-person social connections, those who are engaged with others at work or at home, feel less lonely, feel more healthy, and are more engaged in their communities.
And we see there that the risks associated with loneliness include all sorts of health issues, like you said. I'm curious, though, whether the study looked at the role that technology may play in increasing loneliness. Constantly, we feel that we're so connected to people, but we're actually not having face-to-face interactions. And especially since it seems this younger generation is impacted, do you think that technology is playing a role here?
We actually looked at that as well. We hear all the time about social media and being connected. What our study actually found, however, was that the level of attachment with social media really did not impact loneliness one way or the other. What that means really is I could have 1,000 or 10,000 friends on Facebook, but it's the meaningful in-person relationships that I have with other people that actually keep me from becoming lonely.
Right. Well, it's good to hear that it didn't necessarily have a positive impact, but it didn't necessarily have a negative impact either. So, what are some ways people can strive to not be lonely? What do you think is most important for people to know after seeing this study?
Well, we're excited by this study and really looking forward to continuing the dialogue and working with people, clients, employers, communities to find solutions that can impact loneliness. And all of us hearing this can just make an effort to meet with somebody, have a cup of coffee, and have a meaningful in-person conversation is a great first step for all of us to start to impact this.
All right, Dr. Nemesek, thank you for your time.
Thank you very much.
So what are the markers for loneliness? So as we discussed before, is living alone, having few social network ties, and having infrequent social contact. This means infrequent in-person contact. Loneliness and isolation, have been noted to be risk factors for reduced lifespan. That means they have a higher risk factor for mortality, even higher than smoking and obesity. It raises the risk, I think it's something like 25% increased risk for dementia, as well as anxiety, depression, cardiovascular disease, and in some cases, it has been associated with higher risk of suicide among certain groups. So social connectedness has been strongly linked to having a stronger immune system. There was a study that was done where they gather a group of healthy participants, and the participants completed some social connectedness scales and loneliness scales. And what they did is they then came to the office, and they were infected. They were infected on purpose with the rhinovirus 39, which I'm told is the common cold virus. So it's nothing dangerous. These, of course, were participants that were at low risk, right? And so they were purposely infected with this virus. And yes, such studies do happen to look at different factors that would be associated with people developing the cold, developing the infectious diseases. And what they noticed was that over time, they tracked these participants to see who actually developed symptoms of the cold, and they found that people who reported feeling more lonely were more likely to develop cold symptoms than people who reported being more socially connected. So here we see, I've heard more that actually love is the best medicine. Okay, and I'm not trying to be like a cliche, you know, it's for real. Love is one of the best medicines for people. Um, Loneliness as a risk factor for mortality. Uh, there is an increased risk for mortality for 26 risk for mortality for people who feel lonely, 29% higher risk of mortality for people who are socially isolated, and 32%, look at this, a 32% increase in mortality for people who live alone. These risks for mortality are actually worse than smoking and obesity. I think the number of cigarettes is very high. I think it's a little bit below smoking a pack of cigarettes a day. But you get the idea, right? There's having social networking survival as well as being socially integrated and survival is highly linked. So we see a odds ratio of like 45% higher rates of survival for those who have a stronger social network and 52% higher odds rates of chances of survival for those who are integrated into a social structure. Um, Loneliness is linked with poor heart health. So feeling alone has been associated with coronary heart disease, stroke, and poorer outcomes of health conditions. Um, for example, there's been a studies that show that when people have, for example, when people have heart attacks, when they have other heart conditions for which they need to go to the hospital, um, patients who, after discharge, patients who are feel more lonely or who are living alone are more likely to die following this discharge than patients who feel socially connected or who are living with somebody else. Um, and it could be a number of factors, just the feeling that you have somebody to can help you, who you care about, who cares about you. um, and also for people who are married, having somebody to care for you that can bring you food, that can remind you of your medications, take you to appointments. Um, so um, to me, I feel that that care and compassion is really there. There was another study that look at patients, different patients that some patients that needed to be plugged to an IV machine to dispense some medication. And so they divided them in two groups. One group of the patients was hooked up to a machine that would dispense this medication. The other group of patients were told that a doctor would give them these medications. And so they had these two groups of patients. And what they found is actually that the group of patients that felt that, and the medications were the same. Okay, the medication was the same, the treatment was the same. The only difference was, whether it was being given by a human or a machine. And what they found is that people who felt like they were being cared by another person felt better than the people who were told and were just plugged to a machine. So there is a difference. There can be a difference for some people as to whether this care is delivered by another person or a machine. The loneliness prevalence varies by a number of factors, so sex and gender. I mean, there's different studies that show that by sex and gender, different people may be more isolated than others. But I think in general, women may feel more socially connected. Um, some studies say it's men, but I feel like men usually when it's about the studies relating relationships and feelings, men are not as prone to report on their feelings and emotions like depression and loneliness. So we may have some underreporting of this when it comes to men. What is true is that single men tend to fare worse in the loneliness as well as in other health factors than single women and than married people. So there is such a thing as there's been other studies that show that married men benefit men benefit a lot more from marriage than women, actually, for many reasons. One, of course, the social connections, having that partner, having the care, as well as the in this case is heterosexual relationships. I haven't seen gay relationships, but I can assume it's something similar. Where married people do in general better. But when it comes to men with women, the women remind the men of their health appointments. They help them keep up with their health care. So actually, it's for their benefit for single men to engage in secure long-term relationships. There's also the widowhood effect. People who are partnered, when they lose their partner, there's a 60 to 90% increased chance of dying within the next 3 months following the loss of their partners. Older adults, so for the most part, older adults have been reported to feel more lonely. And I mean, we talk a little bit about this. Maybe they lose their partner, they lose some of their people, from their generation. However, as the video shows, more recently we have seen this increase. This it's very worrisome increase in loneliness among younger groups. And why I say worrisome is because it leads to depression, and this can be chronic, long-term issue. It is contagious, um, and um, and it leads to very poor health outcomes in the long term. So I worry because as the person said in the news report, um, younger people are already reporting poorer health outcomes than their parents and grandparents reported at their age. So we stand to see maybe more burden in our healthcare system in the long term as a result of this epidemic. So also, you may have noticed that we have a mental health crisis among children and youth, and this was before the pandemic. And now with the pandemic, this crisis has just become worse. With younger children going to mental health clinics for emergency care. For example, we see here the incidence, the trends, as we talk about from different studies, that 15% of baby boomers were lonely. Then we have Generation X is 20%, and then millennials 30%. This one doesn't have Generation Z, but it's the trend is there. Younger people today report about 27% report that they rarely or never feel people understand them. Almost half of them say that they sometimes or always feel that their relationships are not meaningful. 1 in 5 report that they rarely or never feel close to people. 1 in 4 report, only 1 in 4 report that they have meaningful in-person social interaction on a regular basis. And this was before, okay, this study was before the pandemic. And again, before the pandemic, there were some studies done about how do Americans make friends. And so the top places, look at the top places where people usually make friends. And this is, again, we're talking about secure long-term relationships, not like casual relationships or online people who you don't meet in person, you know. So the top places are in high school, through work, in college, through local neighborhood, through church or other spiritual community. So I'd like to ask you, what do you think has been happening to these locations, to these places in the last few years? what changes have we seen in these environments, and how are these changes related to this epidemic of loneliness and depression? Another trend that we are seeing is uh, the trend towards smaller families. This could be related um, to the loneliness epidemic. So in the past, people used to have more children, and so we see that in the 1960s there were more households that had more people, and as with every generations we see here, people are having less children, and so or remain single. Um, this year and last year we saw that there is studies that show that we have the highest rate of single men in the United States reported. And again, this points to a number of bad outcomes, as I mentioned earlier, that are related, especially for men. So we are having more household, a share of household that are only one person. And remember what we're talking about, that even if the person may not feel alone, living alone by in and of itself is associated with some poor um, health outcomes. So by this, I am not what I wanted to know. These trends are happening in other countries, and they're seeing the same bad side effects. But what I'm trying to say, I'm not trying to say go out and have a lot of babies. Okay, that is not what I'm recommending either. I'm just saying maybe we need to find ways to grow strong networks that are adapted to these new trends, okay, of connecting in other ways, okay. So I mean, I still think it's good. The family is the primary, has been our prime for thousands of years. Has been families is has been the basis of society and the basis for this social well-being. Um, but so it's good to have a family, but maybe, like I said, I'm not telling you to go have a lot of babies if you don't want to. So maybe we need to look at different ways that we can be socially connected in healthy ways. So another factor that we have is culture. So a little bit of information about a white Anglo culture, which is the dominant culture in the United States. Some people refer to them as either white Anglos or European Americans. Um, so for European Americans or Anglo Americans, it's more of an individualist society. Um, the mainstream culture has been noted by research as being the most individualist culture in the world. In general, Anglo cultures, so that means like from England, like New Zealand, Australia, Canada, are generally some of the most individualist, but of all of them, US mainstream culture is rated as one of the most individualist. So people value independence, autonomy, and privacy as opposed to collectivistic cultures, which are the majority due to, again, agriculture and hunter-gathering society. So interdependent cultures value more collectivism, interdependence, intimacy between people. So we value more like long-term relationships. People who live in independent, individually societies, they tend to put themselves first. They are loosely linked to each other. They're motivated by their individual ideals and goals. They place but more value on self-sufficiency and self-actualizations, and they communicate as individuals rather than within the group. Also more focus on nuclear families as opposed to extended families. So there's been studies actually that show that for white Anglos that have healthy, strong network with their extended family, that is referred to as familismo, are healthier tend to be healthier than people who live on their own, only see their families on the holidays, or focus only on their nuclear families. They tend to have more casual relationships, share non-binding relationships, as opposed to having um, exclusive long-term relationships with their romantic partners, as well as again, classmates, co-workers, family members, neighbors. They tend to be more future time oriented. And then we have here, you can see, read this on the slides, that we have a differences between individualism and collectivism. So you have an idea of the differences. Here we see the cultural value preferences of different groups of people in the United States. And you can see that the majority are collateral, what we refer to as interdependent. But these are changing, of course, as people assimilate to the dominant white Anglo culture. They become more individualist. And this is a portrayal of the differences between how we perceive ourselves in different cultures. And I can tell you that I understand this because I am bicultural. As I mentioned, I'm bicultural. So I understand both cultures, the independent and the collectivist. Something interesting to note is that unlike other factors in which people, for example, people can be bilingual, right? Like understanding English and Spanish. Usually people are either individualist or collectivist or somewhere in the middle, but people are usually not both individualist or collectivistic. They're either one or. Like I said, I understand both cultures, but because of my upbringing, I more interdependent or collectivistic. So we see here that for people who are interdependent, the people around us form more a part of our identity. So if you ask my mother, who are you? How would you identify yourself? She will start by telling you, I'm a mother, I'm a sister, I work here. But when you talk to people who are more individualists, they tend to describe more themselves, like as an individual rather than as people. They don't feel as connected with other people, or that the other people form a part of their own self identities. Like they might say, well, I'm vegan, I'm this, rather than we are, you know we like to do this, or feel like a part of uh, the group. Friendships tend to be different. So in mainstream European American culture, friendships tend to be many, of short commitment, non-binding, and share. For Hispanics, friendships tend to be more intense, long-term, and exclusive. Hispanics place affinity towards intimate social connections. For us, this is referred to as personalismo. So this is not to say that the white Anglos don't develop strong long-term connections. As I mentioned earlier, some of them do. Um, some of them are connected with their extended family networks. They have good relationships. I believe that maybe in some workplaces, people become friends, and then go out to happy hour together. They celebrate each other's accomplishments together. But in other places, in other work cultures, it seems like people just check in, log in their time sheet, do their job, and log out, and I'm done. And they may not be really connected to their coworkers, their classmates, and so forth, as we mentioned earlier. Um, um, Earlier in this presentation. So in general, in the mainstream society, sort of not expected. What matters is that there is not the expectation that people become friends with their coworkers. I mean, at least with some coworkers, some classmates, and so forth. Um, it seems to be more optional and not expected. Whereas for Hispanics, for other groups, it's kind of expected that you will at least get to know your coworkers, get to know your classmates, um, at minimum, and then from there form friendships or romantic relationships. And here we see an example of collectivism. It says immigrant parents Suffering from loneliness is an issue that is severely neglected. Many of them went from growing up in a world filled with friends and strong support base, only to end up in a world filled with nameless neighbors and uninterested coworkers. So I saw this post and I thought about it, and a lot of people have commented on this post that's been circulated, and so um, from my culture, I think it speaks about um, the perception of people who are more interdependent. So let me tell you a few comments here. So if you are thinking, well, you've listened to all of this presentation and you're thinking, well, I don't live alone. You know what? I don't feel lonely. Or, yeah, well, I like to spend time alone. I'm more of an introvert. Or, whatever. I like working remotely. I love this, working in my PJs, waking on my own time. I like working remotely. Or, hey, my family is okay. My family don't feel lonely. That depends, of course, in the terminology. What do you mean by family? Do you mean your nuclear family or your extended family, right? Are people, like we mentioned, seniors tend to be lonelier, and some people may be excluded at work, at school. So you never know. Are your children's classmates connected? Or are they being excluded? Are they being bullied? So if you had any of these thoughts, I have news for you. That's an individualistic approach to a public health issue. That is like saying, hey, I don't need to wear a mask. I'm at low risk of getting COVID. So I'm okay, or hey, if I get sick, that's not that's my problem. That's my choice. If other people want, they need to take care of themselves. So I need you to, as a public health professional now, and as a person, as a member of the society, to think about this, okay? Because I believe a public health issue needs public health interventions. And by that means, not individual intervention, that would be a medical model, right? A one-on-one model of care. Public health interventions look at societies as a whole to come up with solutions, especially in this situation that I feel is more contagious. And again, it's related to the public issue. Um, so I have a friend who, for example, he, you know, he celebrates his children's birthdays. They're like 8, 12, 14, and he just with them at home alone, just them. And so for me, that was kind of strange because I grew up with my birthdays, my family invited neighbors and cousins and friends, classmates. And so I kind of asked him, why you only celebrate with you? Where are your children's friends? And he told me, well, I'm more introvert. He actually used the word antisocial. He said, I like to be on my own. So I just like to be at home and not hang out. And so that's what I do. And I said, well, that is you. But the children need friends. Children need playtime. They need connections, right? We already talked about this and the mental health crisis that children and youth are having now. So I said, you don't know, your girl needs to have a friends, right? So I noticed in the last birthday party, it looks like they did have a party at the school and they went out and it looks like they invited some of the girls' friends, and they seem to have a good time, um, with this social group. So it's something to think about. It's not an individualistic issue, it's a public um, health issue. And also, you never know when your family may be okay, but you don't know if the classmate may feel lonely or people don't hang out with them again, in their birthdays or playtime. Now I mentioned all of this data was collected before the pandemic. The pandemic has only worsened all of these situations for a number of factors. But I remember when the start of the pandemic came and we saw these advertisements were trying to prevent the contagions of COVID-19, and they kept asking people to socially distance. And I went, oh my God, this is, for me, it is great that we're having these prevention strategies, but it shouldn't be called social distancing. Because we are not supposed to remain socially distanced. We need to be socially connected for our own mental and physical well-being. It is only a physical distance between people, keeping some distance to prevent that contagious of death, infection, respiratory illness. So I did this, I'm crossing over the social and try to use the word physical. Here I saw this post, I really liked it. It says during the pandemic, it says we need to be physically distant, but not socially distant. So here we see a group of friends who went out, for a walking club, and trying to keep their distance, but still were spending time together. So I really like this post. And then Bumble Best Friends Forever, Bumble BFF, who is an app that tries to connect people to become friends. They posted this during the pandemic as well. It's a social distancing is not equal to loneliness, okay, and it shouldn't be. Um, so from what I've seen, also we have a trend that people are again, the pandemic only accelerated this trend, but I feel like we've turned more into a remote lifestyle. And for me, I'm going to say this, a remote lifestyle is the McDonald's of socialization. It's comfortable, it's convenient, but it isn't healthy. Okay, so for me, this remote lifestyle that we have, that now it's optional, we go to the office or we just be at home working, um, it's like fast food. Okay, to me, I feel like some people, when you tell them that don't eat fast food or don't eat too much fast food, they're like, well, that's my freedom, that's my choice. Again, in an individualist response, right? I like fast food and I can eat it. Yes, it's comfortable, it's convenient, but people need to know that it's not healthy. And again, if you're thinking, well, I'm okay working remotely, remember that it wasn't like this before, and that your coworkers may be experiencing lack of connection. Okay. So as we move forward, to me, as we move forward with these remote changes, I have to say we need to use technology because it's helpful, because it's great to have these new modes like that app, for finding friends, the Bumble BFF. But we need, as we move forward, we need to do research. We need to know which technology is helpful and which is not, and what is has the same quality and what does not. For example, does teletherapy, doing telemedicine, is that has the same health outcome as being in person? In which cases, sometimes it is, sometimes it's not the same as an in person, as mentioned earlier. So we need to know when is good and when is it not, when is preferable to be in person. And so we have like therapy now with chat bots, and I'm like, I don't know, I just don't, personally, I would not feel the same as seeing a therapist as talking with a person as I would talking to a machine, as I mentioned earlier. So we need to know what is best, and as public health professionals, our job is to inform people and to do interventions for what is healthier, not for what we individually like or what is comfortable and convenient. And so what are the recommendations? What does the research say about this? I would like to tell you, as I mentioned earlier, that love is the best medicine. And for this, I use the word sometimes for instead of saying I love you with all my heart, I usually say I oxytocin you with all my hypothalamus. Yes, I'm a nerd. So what are the recommendations? I love this post somebody made. That means oxytocin, friends, a dosage of friends. So what is the recommended dosage of connections that we need? We need at least 5 contacts with people on a daily basis. That is what we need. So during the pandemic, I recommended my students who were feeling bad during this situation to say, call your friends, call your family, do video calls. Now, of course, we need in person, right? So have at least 5 contacts with people on a daily basis. It's better to have a romantic partner or a significant other. If you are single, the recommendations are that to have at least 2 best friends, 2 BFFs that you can count on to do things with. So it is not necessary to have a romantic partner, but to have some best friends, not just casual friends, but best buddies that we can count on. So there was an intervention done that I was the evaluator for this intervention. It was called Un Nuevo Amanecer. It was an intervention for Hispanic seniors with depression to try to help them. These were seniors over 60 years old who scored 5 or more points. So for mild to severe depression using the PHQ-9, and it involved at least 8 weekly sessions, which could go up to a year with a year follow-up. And this involves behavioral activation, problem-solving treatment, and what we did actually for people who are depressed, they tend to be isolated, right? I self-isolate. They may feel like a low energy to do things, so they began to helping them be connected to a place where they could make friends, where they could be active. So this was part of their behavioral activation. And so as we see this picture, they were invited to sign up for a senior center, to sign up for activities where they could, play games, play chess, pool, cards, to make crafts, and to have shopping trips, or trips to the bingo or casino night. So what the results show for this study is that we had a very high retention rate, usually not seen in other studies. 97% retention rate, 63% showed at least they have their depression symptoms or more. The severity of their depression went down significantly. They improved physical functioning, quality of life. And when it came to social connectedness, remember the items I presented to you earlier. They have a clinically significant increase in their social connectedness with their friendships that they have, people they could do enjoyable things with. Belonging in the community and having the support they need in a crisis. This was 1 year after the intervention. So now I have some questions for you to think about. This is your questions related to this module. So as a public health professional, now let me ask you, at the beginning of this session, I introduced you to the blue zones, the factors that are associated with long and healthy life expectancy. So let me ask you, which of these factors do you think is directly associated with social connectedness? Which of these factors do you think are even just indirectly associated with social connectedness? How do you think these factors relate to good health outcomes? Okay. Now we have some information about health disparity. So before we talk somewhat about the white Anglo culture in the United States, so as every group, every racial and ethnic groups have certain areas of priority that we need to work on for their health. Hispanics may have some risk factors associated with some conditions, as well as Black African Americans and so forth. For white Anglos, researchers have noted these diseases, which they term diseases of despair, that seem to be a priority issues among this group. And these diseases of despair include drug overdoses like opioids, for example, heroin and so forth, alcohol addiction, depression, as well as some intended injuries. And this is intended injuries in the form of suicide, mass shootings, and school mass shootings. Especially when it comes to these intended injuries, even more so among white Anglo males, especially younger European American men. So let me ask you, how do you think that loneliness is associated with all of these diseases of despair that we have? Um, you often hear that, for example, how often do we hear about the people who commit the mass shootings that, oh, they felt lonely, or or that they were bullied at school, that they were excluded at their workplace? Okay, so I ask you this question: how is loneliness associated with these diseases of despair, and what can we do to improve these um, diseases? Another question now is, we will see here that there are warnings, right, about the terrible health outcomes of smoking cigarettes. And we have this in cigarette packets with the Surgeon General warning: smoking causes lung cancer, heart disease, emphysema, and may complicate uh, pregnancy. Then it says it causes fetal injury, premature birth, low birth weights. Okay, we have signs now that says, no tobacco or marijuana smoking in public places at any time, because it's bad for it's for secondhand smoke. Both, for all of this, it's bad, right? Secondhand smoke is bad for tobacco smoke, marijuana smoke, and vaping smoke. Okay, so we have signs to inform people. We have a whole campaign to tell people about how to protect themselves from COVID, right? With wearing a mask, physical distancing, washing their hands, and so forth. We have warnings about um, drinking soda, drinking beverages with added sugars contributes to obesity, diabetes, and tooth decay. So my questions for you is, why are we not addressing the loneliness epidemic in the same way that we're fighting smoking, obesity, and COVID-19? Why do you think that is? And as a public health professional, what are your recommendations for addressing this epidemic? Again, I love these pills that have the heart-shaped pills. So what would be your prescription for a specific target group when you do your audience segmentation? You know, who would you target? What would you do? What strategies would you do? When, where, how would you deliver this intervention? Okay, so this is how you would design a program. You have any ideas? I have, for example, thought about starting a program called Pick Your Office program, where for employees who are working remotely, where maybe they have a long drive to go to work, they have children, but they would still enjoy coming to a work site. They would still benefit from not working with children, around, and from having these social connections, celebrating with coworkers. So maybe we have multiple sites where people can come and share offices with other people, offices that could be nearby their children's daycare and school. So it doesn't have to be their office from their employer, but rather employers come together to share offices at more convenient locations. This could be interdisciplinary environments. So you may have an architect that comes with that is right next to a graphic designer, that is right next to an engineer, right next to a teacher, and just sharing some time, maybe 2-3 days a week, when their children, or just during the time that the children are at school, so that we'd still getting that social connection, and maybe benefit from this exchange of ideas with people from different fields. and having also the benefit that if you pick your office, you can pick it which is close to your daycare, your school, your house. There's less commute, and you can pick your coworkers. Maybe you like a certain working culture better than a different working culture. So I don't know. This is something exciting um, that I would be, I think, interested to explore. What would you propose uh, to address um, this epidemic and increase social connectedness? So thank you. I hope you learn from this module.